It was a sight that was seldom seen in Washington. Bipartisan praise for President Bush's reauthorization of a plan for global AIDS relief. It's called PEPFAR. And it's the largest international health initiative ever for a single disease.
The legacy of this administration will be the work that this president has done regarding the global AIDS epidemic.
But while we as a nation spend almost $10 billion annually to fight AIDS abroad, we spend less than 10% of that here at home.
There's tremendous irony that while we're showing leadership on the global epidemic, we're showing complete neglect on the domestic epidemic.
And estimates by the Centers for Disease Control reveal African Americans in particular are disproportionately affected. In the year 2006, blacks accounted for 45% of new HIV infections, more than 22,000. The reasons why?
One of them is shame. People are ashamed to have the infection. The other is stigma. They're punished if someone else finds out they have it. And then the third is ignorance.
It's a pandemic that's spreading right under our nation's nose. The Centers for Disease Control estimates that 1 in 20 people living here in Washington, D.C. is HIV positive. Astonishingly, in the capital of the world's wealthiest country, the incidence of HIV/AIDS is 2.5 times that of Port-au-Prince, the capital of Haiti, one of the world's poorest countries.
I'm C. Russell, I'm 31 years old, and I'm HIV positive.
Russell was diagnosed 9 years ago after having unprotected sex.
But 80% of the HIV/AIDS cases in this city, your city, are in blacks.
They are.
What is going on here?
Apathy in our community, apathy possibly maybe from the government, people not going and getting tested and getting treatment once they've been diagnosed.
Luckily, Russell's been able to keep the virus at bay without the need for medication. But if he did get sick, care and treatment costs over his lifetime could easily top $275,000.
If it came to that, I'd want to know that I'd be taken care of. I'd want to know that I'd be able to get health care.
But it's not just men.
My name is Danielle. I'm 42 and HIV positive.
The incidence rate for black women, like Danielle, is nearly 15 times that of whites. Danielle contracted HIV through sexual intercourse 15 years ago and passed the virus on to one of her 5 children during pregnancy.
A lot of people are in the mindset that, well, because we have medication we can take, it's okay if I become HIV positive.
But Danielle has no health insurance, so she'll be in trouble should she ever develop AIDS.
So you couldn't even get all the medications that you need. You couldn't get the subspecialty care that you need. What would happen to someone like you?
I'd probably get sicker and possibly even die.
Where do the candidates stand? For starters, they both fully support President Bush's PEPFAR program. But that's focused on the epidemic overseas. So what if you're one of the 1.2 million Americans living with HIV/AIDS?
We have to have a much more effective AIDS policy. The studies have shown that we may have undercounted the incidence of AIDS in this country.
Barack Obama's plan begins with his promise to sign universal health care legislation by the end of his first term as president. He wants to prevent HIV through sex education and by promoting HIV testing in minority communities. But the cornerstone of the Obama plan calls for a national HIV/AIDS strategy involving all federal agencies.
When we give money to developing countries to fight AIDS, we demand that they have a national AIDS strategy. And yet we don't have a national AIDS strategy in this country.
I think we need a domestic plan.
John McCain's prescription to prevent HIV? Emphasize abstinence programs. For those with pre-existing conditions such as AIDS, he wants to establish guaranteed access plans for affordable insurance. His prescription for rising drug costs, greater competition among drug companies. But the centerpiece of the McCain blueprint? A $2,500 tax credit for individuals to purchase the health care coverage of their choice.
How does that affect you?
It sounds like I'd get a tax credit for money that I would spend on health care, which is okay, but I'd rather have the health care.
You also have to have a health care insurance company that accepts you.
Exactly.
For now, Russell may not benefit more from either candidate's plan because he already has health insurance through his employer. On the other hand, Danielle would have a better chance with either candidate than she has now to find affordable coverage. But there was one thing Obama said that captured her attention.
Especially in the African American and Latino communities, it is skyrocketing.
Just the fact that I guess Senator Obama speaks specifically to the community of which I belong, it makes me know that he cares about the African American community.
Nevertheless, both Danielle and Russell are hopeful that the leadership America has shown overseas will inspire the next president to show leadership on the AIDS epidemic here at home. Dr. Sanjay Gupta, CBS News, Washington.